Upon completing this in-service, you will know, number 1, what nutrition risk screening is and its importance. Number 2, be aware of federal regulations that guide nutrition risk screening. And number 3, be aware of different types of nutrition risk screening tools. Nutrition screening is a way of determining if a resident is at risk for under or malnutrition, not at risk for under or malnutrition, or normal nutrition, or under or malnourished. The result of the screening is known as the resident's nutrition status. This includes both nutrition and hydration status. Once a resident's nutrition status is determined, interventions can be started to help prevent decline and or promote improvement in nutrition status. Federal regulatory guidance on nutrition risk screening, the early identification of residents with or at risk for impaired nutrition or hydration status may allow the interdisciplinary team to develop and implement interventions to stabilize or improve nutritional status before complications arise. Failure to identify residents at risk for compromised nutrition and hydration may be associated with an increased risk of mortality or impairment of anticipated wound healing, decline in function, fluid and electrolyte imbalance or dehydration, or unplanned weight change. Ensuring a resident receives the fluids they require can easily be overlooked. Individuals who do not receive adequate fluids are more susceptible to urinary tract infections, pneumonia, pressure injuries, skin infections, confusion, and disorientation. A systematic approach can help staff's efforts to optimize a resident's nutrition status. This process includes identifying and assessing each resident's nutritional status and risk factors, evaluating and analyzing the assessment information, developing and consistently implementing pertinent approaches, and monitoring the effectiveness of interventions and revising them as necessary. Weight loss, poor nutritional status, or dehydration should be considered avoidable unless the facility can prove it has assessed or reassessed the resident's needs, consistently implemented related care planned interventions, monitored for effectiveness, or ensured coordination of care among the interdisciplinary team. The process for determining nutritional status. Identify and assess each resident's nutritional status and risk factors. Complete a nutrition risk screening tool that provides a number value to each answer or an overall score. When the risk screening is completed, compare the results to the screening score to know if a resident is at normal nutrition, at risk of malnutrition, or malnourished or undernourished. Nutrition risk screening should be completed as part of the comprehensive assessment and as needed in between, which includes at admission, significant change, or annually. Evaluate and analyze the assessment information. If at risk or already malnourished, then look at the reasons why. The selections or number scores will indicate the reasons for the results. Focus on these items for care plans and care plan interventions, and speak to the resident or their family or representative as possible for nutrition history that may explain some of the risk assessment answers. Develop and consistently implement pertinent approaches and monitor the effectiveness of interventions and revise them as necessary. Proceed with care planning that provides interventions to prevent further decline and or promote nutritional status improvement. Consult with the resident, family, or representative as possible for their goals and their choices as reasonable for interventions to aid in preventing decline or promote improvement. Reassess nutritional status regularly to see if care plan goals are met. Let's test your knowledge. Screening for nutrition risk. Question number 1. Nutrition risk screening is A way of determining if a resident is under or malnourished. B, is required by federal regulations. C, determines a resident's nutrition status. Or D, all of the above. And the answer to question number 1, nutrition risk screening, is D, all of the above. Question number 2, if a nutrition risk screening is not done, then residents run the risk of A, under or malnutrition, B, dehydration, C, unplanned weight changes, or D, all of the above. And the answer to question number 2, if a nutrition risk screening is not done, then residents run the risk of D, all of the above. Question number 3. Federal guidance on the process for determining nutrition status includes A. Identifying and assessing each resident's nutritional status, B. Evaluating and analyzing the assessment information, C. Developing and consistently implementing care plan approaches, or D. All of the above. And the answer to question number 3. Federal guidance on the process for determining nutrition status includes D. All of the above. Question number 4, true or false? Nutrition status includes nutrition and hydration status. The answer to question number 4 is true. Question number 5, true or false? A nutrition risk screening tool can be a validated tool or one created using current standards of practice for determining under or malnutrition. And the answer to question number 5 is true. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or consulting dietitian services, please contact us at Nutrition Care Systems, 1-800-761-9200 or nutritioncaresystems.com.